Hi, everybody. It's Jessica Hutchins from Inspire Wellness. Today, I'm doing our Facebook Live coming to you from Kemper House. It's a nursing facility for Alzheimer's residents, and they're doing absolutely amazing things with functional medicine and nutrition to try to bring these residents a little bit more peace of mind and quality of life. So yay, Kemper House for doing that. So I'm seeing patients here today, so I just thought I would do the Facebook Live from here. So you don't have Dr. Nidus with you, but he'll be here next week. So thyroid disease, it's becoming pretty much of an epidemic now. There are way more people with low thyroid function than there were 5 years ago, 10 years ago, probably even a couple of years ago. There's lots of reasons for it. Probably the biggest reasons I see are poor nutrition, toxins, and then autoimmunity. And there's lots of things that can cause autoimmunity. But let me start with the basics. So your thyroid gland is right here on your neck, and it makes a hormone. It makes a bunch of different thyroid hormones. T4 is the most well-known. That's what Thyroid is, and that's the most common medicine for hypothyroidism. And the T4 is not really the most active form of thyroid hormone. You have to make it into T3, and T3 is the most active that actually binds to the cells and causes the actions that thyroid hormone produces. Problem is, so if you start here with T4, it doesn't always go right to T3. It can go this way to reverse T3, and it can also go this way to T3. Reverse T3 doesn't bind or doesn't allow the T3 to bind to the cells. So you can be making a lot of T4 or ingesting a lot of T4 through Synthroid or levothyroxine, but you might have some blocks in the conversion from T4 to T3. And that's where I see a lot of people come in who have been diagnosed with hypothyroidism, started on Synthroid, and still feel crappy. And the TSH is pretty much the only measure of that. So that's kind of how thyroid hormone works in the body. And every single cell in your body has a thyroid hormone receptor, so it's extremely important, and the functions are all over the place. So let me briefly go through some of the hypothyroid symptoms, because they can mimic a lot of things, but sometimes people hear these symptoms and they say, oh, that's me for sure, but then they go have their thyroid tested and they're told it's normal. So let me talk about the symptoms, and then let me talk about the optimal and ideal testing for that too. And again, everybody has a different opinion, every doctor has a different opinion, but in my clinical practice, these tests have worked pretty darn well. And if you pair those along with the symptoms people are complaining about, that's where I come up with the treatment, and again, it seems to work pretty well. So some of the symptoms, obvious thyroid symptoms, are inability to lose weight or being overweight, being constipated, pooping once a week is not normal, depression, more of a melancholy depression rather than an anxiety depression, swelling, cold hands and feet, dry hair, dry skin, hair falling out. Those are probably the big ones. Also, high cholesterol can get from having a sluggish thyroid. And so the testing you want to do, you don't just want a TSH. TSH is notoriously an inaccurate test of how people are feeling clinically, at least in the low ranges. If your TSH is super high, then yeah, you obviously have a problem. But it's when it gets into the 1.5 to maybe 5, where it's still normal in the reference range, but clearly there's a problem. So because it's not the best test in the world, I would suggest doing other tests along with it to incorporate in a whole thyroid panel. So those tests specifically are a free T3, and T3 is the active thyroid hormone. Free T4, because again, when I was saying that T4 is up here, and you want to make it to T3, not reverse T3, if you check your T4 up here and it's high, and you check your T3 down here and it's low, and you check your reverse T3 down here and it's high, then it doesn't take a rocket scientist to figure out that you have a break in the conversion here of the T4 to the T3, and you're making too much reverse T3. So checking all of those, a TSH, a reverse T3, a free T3, a free T4, and then also I always add on autoantibodies, thyroid peroxidase antibodies, and thyroglobulin antibodies, because Hashimotos is so prevalent. So that's how most people tell if they actually have an autoimmune thyroid condition, is through antibody levels. It is very important to know, because there's no other symptoms sometimes besides the high antibody levels, and treatments are different. You need to focus on the cause of the autoimmune reaction rather than just replacing thyroid hormones. So let me talk a little bit about Hashimoto's specifically. So it is an autoimmune disease where your immune system attacks some of the thyroid gland itself. So some of the symptoms of that can be a little bit different. Sometimes people get hyperthyroid symptoms, which can be anxiety, irritability, heart palpitations, excessive sweating, heat intolerance, things like that. So totally the opposite of hypothyroid symptoms. So if you're getting the hyperthyroid symptoms intermittently with hypothyroid symptoms, you can sound crazy when you go tell a doctor all your symptoms because they're all over the map. But it could be because during those times of an acute autoimmune attack, the cells rupture and they release more thyroid hormones. So you have almost a burst. So I do see palpitations common, very, very common, is one of the presenting symptoms of Hashimoto's thyroid disease in particular. But I recommend just having a whole panel. So let me repeat those tests one more time. And feel free to go to your doctor and bring them a list. I mean, some doctors are receptive to you researching information and asking for tests. Others aren't, but you can at least try to educate them about this. So TSH, a free T3, free T4, reverse T3, TPO antibodies, or they're also called microsomal antibodies, or thyroglobulin antibodies. So go ahead and ask for all those tests. Ideally, here's where some of the controversy comes in. So ideally, you want the TSH to be a pretty tightly controlled, maybe around 0.5 to 2.5. Again, different doctors have different reference ranges, but often the reference range that's listed on the lab result is way too high. Most women who have a TSH of 5 in my clinical practice feel pretty darn crappy, which is a normal result on the test. So the free T4 and free T3 you want in the second half of the reference range. So when you look at your lab results, just divide that reference range in half and look for it to be in the second half. Reverse T3, anything over around maybe 15, 18, 20 for sure, I would start worrying about. And then any antibodies at all are worrisome. So the thyroid is kind of like the canary in the coal mine. It's one of the glands that first starts dysfunctioning when there's anything out of balance. So if you are diagnosed with hypothyroidism, please look for the cause. Is it autoimmune based? Is it nutrition based? Is it toxin based? Is it that you are under so much stress in your life and you have such high cortisol, which is the stress hormone, that that's interfering again with the conversion? Remember the T4 up here down to T3. Is it blocking that? That happens all the time, and that'll result in you making more reverse T3 over here instead of regular T3 over here. So if you have a high reverse T3, a low or low normal free T3, and a high or high normal TSH, then you want to look for stressors. It could be external stressors, obviously, stress, work, life, being happy, fulfilled in your life. It could also be internal stressors, gut infections, latent viral infections, heavy metal toxicity, things like that. So let me talk a minute about the nutrition part of thyroid, because not everybody has Hashimoto's or Graves' or an autoimmune process going on when they have low thyroid. So selenium is a really, really important nutrient, mineral in thyroid. We're all really low on minerals. It probably has to do with, first of all, that no one's eating real food anymore. It's all processed food. And then also because the soil is not being cared for by the farmers like it used to be. So the minerals are being eroded and nutrition is not like it used to be in the soil. So selenium, again, is one of the big things, especially for Hashimoto's. Selenium, there are studies that show that selenium has actually brought down the antibody levels with that intervention alone. So you want to take about 200 micrograms of selenium, give or take. And I don't know if anybody knows what Brazil nuts are, but those are a great method of getting selenium in, maybe 3 or 4 Brazil nuts every day. If you don't like those, though, go ahead and get a selenium supplement or a multi-mineral supplement. Zinc is another really important one. Zinc anywhere from 10 to 50 milligrams a day. You can test to see how deficient you are. Vitamin D is very important. It's low vitamin D is seen in almost every single Hashimoto's patient I've had, unless they're actively trying to fix it or replace it. Vitamin D is very important for your immune system. Ideal levels for me, I'd like to see them between about 50 and 80. And, we live in Ohio, so we all pretty much have low vitamin D unless we're trying to fix it. Vitamin A is another really important one. Cod liver oil is a good source of those fat-soluble vitamins, too, if anybody likes the taste of that. B vitamins, magnesium, but honestly, the selenium, zinc, Vitamin A and D, I would say, are the big ones. So iodine, too. There's a little controversy about iodine. Some people feel like too much iodine can trigger an autoimmune attack, so I would be cautious of taking too much iodine. But about 150 micrograms of iodine is safe for everyone, and we probably are deficient and do need it. And the particular kind of multivitamin I love, which is from Pure Encapsulations, Pure Genomics, it only has, I think, 70 micrograms of selenium, but it has 150 milligrams of iodine, and then it has 25 milligrams of zinc. So a pretty good dose of minerals there. It just doesn't have any magnesium in it. So that's the nutrition. And then for Hashimoto's specifically, so with any autoimmune disease, you've got to find the triggers. It's not good enough to get that diagnosis. That's not your goal, is to try to go around to a doctor. It might seem like it, and then finally get the diagnosis, and everything's better because you have the diagnosis. Well, that's just the beginning. Then you have to figure out what are your triggers. And leaky gut, which you guys mostly have probably heard about before, that is absolutely associated with autoimmune disease. So look in the gut to start. Are there food sensitivities or food triggers you have specifically? You can test for that. You can do an elimination diet to try to figure that out. Are there different bugs that are overgrown and causing a problem? Or is there dysbiosis? Is there too much yeast? Are there parasites? Oh, we are meant to live in peace with parasites. Often there's some parasites that kind of overtake things, especially in Hashimoto's. So looking for that is a good idea. Stress, again, number one toxin. So try to find mindfulness activities to manage your stress. And different heavy metals for sure can block the chemical reactions that are needed for thyroid. They can be triggers for autoimmunity. Lyme disease can be a trigger for autoimmunity as well, and so can mold exposure. That's very under talked about, but there's a lot of water damaged buildings around, and there are a lot of people who are susceptible genetically to mycotoxins or mold toxins, and that can trigger autoimmunity. Vaccinations, for example, can sometimes trigger autoimmunity. HPV vaccine has been linked to teenage girls developing autoimmune diseases. So there's a lot of triggers, and they're different for everybody, but you have to figure them out. You can't just take Thyroid and be done with it. So go find a doctor or do your own research. There's a lot of good books out there. Isabella Wentz is a thyroid pharmacist. She has a really good book that's relatively new. Amy Myers is a doctor who I think hers is called The Autoimmune Solution. Susan Blum is another functional medicine doctor that has a good autoimmune book out there. So there are lots of good resources out there. And then I do want to mention a food specifically. So obviously an anti-inflammatory diet is really important no matter what the cause of hypothyroidism is. But gluten specifically has been shown over and over and over again to be associated with flares of Hashimoto's. So probably 19 out of 20 people I see with Hashimoto's noticeably feel better when they're off of gluten, and when they accidentally or on purpose eat some gluten at a holiday or a family gathering, they feel horrible. They wake up the next day, they're all swollen, they're tired, they have brain fog, and they notice. So try a trial off of gluten, because gluten, again, is very much associated with having autoimmunity on the thyroid or Hashimoto's. There's a lot of other reasons gluten isn't good either, but that's the main one for this. So let's talk about medicine a little bit for thyroid. So there are natural ways to try to increase the thyroid. Like I said, figure out why you have the problem in the first place. So if it's a lack of nutrient, you fix that, easy enough. If it's stress, you try to deal with that and get your cortisol levels down. If it's heavy metals, you deal with that. So again, you find the cause. But a lot of times you need either temporary thyroid support via medication, or sometimes there's permanent damage done to the gland and you do need long-term thyroid support. Don't think of it as a weakness just because you need a prescription medicine, because it is often necessary. It's probably the most prescribed medicine I give. There are a bunch of different kinds. There's Synthroid or levothyroxine, which is T4. Again, 19 out of 20 people that I see tend to do worse on T4 or Synthroid as opposed to a natural thyroid that has T4, T3, T2, and T1 in it. And the reason is, again, when you have T4 up here, it can go to reverse T3, it can go to T3. If you can't make this conversion to the T4 to T3, it's going to go to the reverse T3, and you're going to still feel like you have hypothyroid symptoms. If you have a medicine that actually gives you a little bit of the T4 and the T3 in it, then you're not relying on your body to make this conversion the right way instead of going the wrong way. So that makes sense. So some of the more natural thyroids are Armour thyroid, Nature Thyroid, WP thyroid. Those are the big ones. And they all have different fillers. So they're not always all available, but they definitely all have different fillers. So based on your different sensitivities, or, try different ones out and find what's right for you. So don't be opposed to medicine if you need it. Sometimes it's short-term, sometimes it's long-term. So remember, if you have autoimmune disease, find the triggers. If you have hypothyroidism and you don't know what the source or the cause is, figure that out. Is it nutrition? Is it toxin? Is it stress? Is it autoimmunity? How is your gut? How is your diet? How is your mindfulness activities? How is your toxin exposure? Those are all very important things. And then find a doctor that'll do the right thyroid tests and give you options with treatment. It doesn't always have to be Synthroid or T4 because that often doesn't work. So hopefully this was helpful. Thank you guys very much. So next week, we are going to talk about not so interesting topic, really. It's about our membership at our office and our payment structure, because we've been getting inundated with questions about that nonstop. How do you accept insurance? How do you get paid? What's the cost? What's the membership like? Who would benefit from a membership? So as much as we don't like talking about that part of our business, we want to talk about it because we want to give you guys information, practical information, so you can make a good decision about whether or not this is right for you. So please tune in next week. Thank you guys, and let me know if you guys have any questions. Just type them in the Facebook. Thanks.